And it's time for Move Well, Live Well with PCI Orthopedics. Today we're talking about something I feel like is very, very common, hip and knee replacements with Dr. David DeMik. Did I say that correctly?
You did.
I did say that correctly. And you're an orthopedic surgeon. You probably do a lot of these hip and knee replacements. Are they more common?
Yeah, and I do specialize in hip and knee replacements. That's the focus of my practice, and they are very common here and throughout the country. You know, they do over 1 million per year in the United States currently.
Oh, wow, that's a lot. So let's talk about, what they are and how do you know if somebody needs one?
Yeah, good question, Chris. So a couple of things you need for hip and knee replacement. So, first you want to have arthritis, and we determine that based off x-rays. So radiographic arthritis, which is usually loss of cartilage, formation of bone spurs, or other degenerative type changes in the joint. And it also has to be symptomatic, because just because people have a junky looking joint on x-ray doesn't mean it always hurts or it causes pain or symptoms. Usual symptoms are pain, loss of motion, limits with activities, and other sorts of things. Usually when it kind of creeps in like family activities or like leisure things, that's a good reason to consider having something done about it. And then you also want to try all the non-surgery things first. That would be things like medications, Tylenol or anti-inflammatories if you can take them, doing like exercise or physical therapy. Some people will do braces, try using canes, walkers, limiting their activities or changing up their routine to see if that helps. Or injections sometimes can help too, but
I've had those.
Yeah. Unfortunately though, sometimes the joint's just too far gone for all the non-surgery things, and at that point we think about having a surgery. Okay,
all right. So I kind of want to talk about recovery. I think that's a big one for people, because they're worried, oh my gosh, if I have a hip replaced, knee replaced, it's going to be a long recovery period. It's not, it's not going to be easy, but tell us about it. Is it outpatient? How does that work? Yeah,
every patient's a bit different, but in general, we do the surgery. You're up same day walking with a walker, which is a big change from historical times when people were on bed rest for a while, so we get you up moving pretty early.
So different.
Yeah, very much. Usually use a walker for a couple days or a few weeks till you get your legs under you, then you transition down to a cane when it's safe, and then eventually leave the cane behind. As a rule, hips are usually easier than knees. On average, it takes about 90 days to get 90% better following the surgery. Hips or knees are a little bit more challenging. I tell people the first month is pretty tough, and that you're going to hate me for 2 weeks and probably dislike me for 2 more weeks, but by about 90 days, you're about 90% better from the surgery.
Then you're the best friend then.
Right.
Yeah, right?
Well, it's kind of a good cop, bad cop with the PT sometimes, so it's a team approach.
Yep. I know that you think that hip is such a big muscle that you're digging into, because people think that would take a long time for recovery, but not the case.
Yeah, the hip joint's a little bit more simple. It's a simple ball and socket. Plus, we've developed new techniques too with muscle sparing surgery. We don't have to actually cut any muscles. We kind of work in between them for a lot of hip replacements now. So that does lead to quicker recovery early on. So what a hip replacement is, it's usually 4 parts. There's this kind of metal socket that kind of goes into the pelvis. Inside that, we put this plastic liner. That's kind of like the tread on your car tire. So that kind of snaps in there. And then there's a stem implant that goes down inside the femur with a ceramic ball, which is usually pink, and that kind of restores the hip joint. Okay,
that is such a small device, I guess, if that's the correct term for it, small device, because I would think that would be a lot bigger for your hip because it's such a big area, but that's pretty intricate.
And historically they have been, but over time we've learned that you don't have to put a huge implant in the femur, so they've been shrinking over time, and they have better results.
Yeah, so. Which I kind of want to talk about how these have changed over time.
Yeah, we touched on that a little bit in that, the early on it was a lot of bed rest, less is more, but now it's all about early mobilization. We've done better with, coming at pain from different ways with, injections during the surgery, different types of medications to help people feel a bit better afterwards, and most of all getting people moving. So these joints want to move afterwards, so that really does help people in their recovery.
That seems much different, like you said before, when it was just like a lot of bed rest, but now, move right away. I know my dad had both of his hips replaced, and he was home walking around right away afterwards. Probably not using his cane like he was supposed to right away, but he was moving around a lot. The knees are trickier though, so tell us about the knee.
Yeah, here's what a knee replacement kind of looks like. So some people think you kind of just take off a large chunk of bone, but really it's actually more of a resurfacing where we kind of just shave off the ends of the bones, and we try and put back what we take away with metal. And so you put a metal cap on the femur, the thigh bone, similarly a metal cap on the shin bone, the tibia, and in between there's this plastic liner, and that kind of becomes the knee joint there.
Okay, all right.
So knees are a little harder with recovery. There's a lot of variability patient to patient. We do the same surgery the exact same way every time, but some patients recover faster, some a little bit slower. But I sort of joke if you ask 10 friends and family about their knee replacement journey, you kind of get 10 slightly different stories.
That's fair. Is it quite often where people will have one hip replaced and will have the other, or with the knees, or is that as common as what it appears to be?
It can be, because arthritis can run in families. So sometimes, mom has it, grandma had it, aunt and uncle had it. Yep, yeah. Exactly. So I tell people you can blame your parents for the arthritis. And, sometimes people, it's all symptom driven and limitation driven. So sometimes if people have arthritis, but they're doing quite well after surgery, they're saying, hey, I can do everything I want to do. I'm not limited in any way, even though my right hip is worn out on the x-ray. Then we say, hey, we'll just keep an eye on it. Whenever you're ready, we can do it. Similar with the knees, sometimes people say, hey, I'm limited, I want to have it done, then no problem, we'll get you a matching set. Other times, if you want to kind of go back to their normal activities, kind of, focus on their life instead of being in recovery mode all the time.
Right. What can people do before surgery to kind of ensure that their recovery period and the surgery is going to be successful? That's
a good question. People can go to, therapy or do some home exercise to kind of maintain the mobility of their joints and kind of build some strength that can help them in their recovery. You want to, rest up and get all your medical issues all kind of tuned up. We talked about like medical optimization, so we have you see your doctor before, check your blood work, make sure you're all tuned up for surgery because we want to make sure you're as healthy as you can be for the surgery so you have the lowest risk of any kind of complications or any issues. Doing good nutrition, like high protein can be good because you got to heal up from all we put you through to recover from the operation too.
All right. Thank you so much, doctor. I appreciate it.
My pleasure. Thanks for having me. Yep.